Dr. Charles Moak, we're going to go over CoolLipo, laser liposuction, actual patient demonstration. This is the laser tip, which you can see as the red light. The laser is infrared, you can't really see it, but there's an aiming beam at the tip of the laser so we can see where the tip of it's at. We've already anesthetized the patient with a local anesthetic, and we're using this laser to melt the fat and tighten the skin. Now, in addition to tightening the skin, we should see some additional fat destruction, additional disruption of fat, which allows more thorough and even liposuction. You can see the incision site is only about 1 millimeter in size, which is very tiny, about 1/16 of an inch. We can do this laser liposuction procedure through the tiniest of marks, so you can't see scarring afterwards. Now we're on the other side. We're suctioning out after liposuction with a 3 millimeter cannula. That's about a little bit smaller than 1/8 of an inch or 1/4 inch. I'm sorry, a little bit smaller than 1/4 inch, about 1/8 of an inch. And there's another 3 millimeter cannula. So we laser first to disrupt the fat and to break the fat up, and then we go back and suction the fat out. If you do the laser without liposuction, there will be very little effect. The liposuction is done with some abrasiveness with a cannula and also with suction. We carried out to an endpoint, basically checking the skin fold thickness. She started out at about 35 millimeters of skin fold thickness, and we're going to suction this to a point of about 10 millimeters of skin fold thickness. The surgeon has his hand at all time underneath the probe, on top of the probe, so we can feel where the tip of the probe's at and control it. And again, we make multiple small incisions so we can attack the fat from multiple different angles, getting more thorough liposuction. This leads to less unevenness and less pockets of missed fat. In the drainage, you see how the holes, it looks a little bit bloody, but there's very, very small amount of blood. Less than a teaspoon of blood would be lost through the whole procedure. Now here at the end, her skin fold thickness is 1/2 an inch. So she went from about 2.5 inches down to about 1/2 an inch thick. And we're finished.